Pain on the outside of your elbow when opening a jar, turning a doorknob, or lifting a kettle. You might have tennis elbow, also called lateral elbow tendinopathy. Today, I'll show you evidence-based home exercises that may help reduce pain, improve grip strength, and support tendon recovery. What causes tennis elbow? Tennis elbow happens when the wrist extensor tendons on the outside of the elbow become overloaded from repetitive gripping, lifting, typing, or sports. The tendon most commonly involved is the extensor carpi radialis brevis, which helps extend the wrist during gripping and lifting. Research suggests that gradual loading and strengthening of tendons help tendon recovery more than complete rest. Before starting exercises, let's check if the symptoms are consistent with tennis elbow. Common signs include pain on the outside of the elbow, pain when gripping objects or opening jars. Two simple tests sometimes used clinically include a resisted middle finger extension. Try lifting your middle finger while your other hand gently pushes it down. Pain on the outside of the elbow may suggest tennis elbow. Resisted wrist extension. Try lifting your wrist upward while your other hand provides resistance. Pain on the outside of the elbow may suggest a tennis elbow. Symptoms such as numbness, significant swelling, joint locking or clicking are not typical and may suggest another condition. These tests can be helpful, but they do not provide full diagnosis. If you're unsure, consult a physio or a physician. Let's review the exercises. Wrist extensor stretch. Start with a gentle stretch. Extend your arm straight in front of you with the palm facing down. Use your other hand to gently bend the wrist downward. You should feel a stretch along the forearm. Hold it for 20 to 30 seconds, 3 to 5 times, 2 to 3 times per day. Isometric wrist extension. When the pain is sensitive, isometric exercises can be helpful. Rest your forearm on a table with your hand hanging off the edge, palm down. Try to lift your wrist upward. Use your other hand to resist so that the wrist does not move. Hold it 30 to 45 seconds. Repeat 4 to 5 times, 2 to 3 times per day. Eccentric wrist extension. Eccentric loading has strong research support for tendon rehab. Hold a light dumbbell or water bottle with the palm facing down. Use your other hand to lift the wrist up. Slowly lower the weight over 3 to 5 seconds using the affected arm. 10 to 15 repetitions, 2 to 3 sets, and you can do it 3 to 4 times per week. Start light and progress gradually. Concentric wrist extension. Concentric loading also has strong research support for tendon rehab. Hold a light dumbbell or water bottle with your palm facing down. Slowly lift your wrist by extending it, then lower it back down under control. Perform 10 to 15 repetitions of 2 to 3 sets, 3 to 4 times per week. For both concentric and eccentric exercises, gradually increase the load as tolerated, since progressive loading is essential for tendon healing. Avoid sudden increases in weight to prevent tendon flare-ups. Grip strengthening. Grip weakness is common with tennis elbow. Squeeze a soft ball, roll towel, or a therapy putty. Hold and squeeze for 3 to 5 seconds, then relax and do it 10 to 15 times, 2 to 3 sets. This helps improve low tolerance of the forearm tendons during everyday activities. Forearm rotation. Forearm rotation can also support elbow function. Hold a hammer, dumbbell, or a water bottle vertically. Rotate the forearm slowly from thumb up to palm up. Return slowly to the starting position. 10 to 15 repetitions and 2 to 3 sets. Can you do exercises with pain? Some mild discomfort during exercises can be normal. Try to keep the pain below about 4 to 5 out of 10. Temporary soreness afterward can occur, but sometimes symptoms should generally settle within about 24 hours. If pain increases significantly or continues to worsen, reduce the load, repetitions, or frequency. Strengthening muscles around the shoulder and upper back, such as rowing exercises, may also help reduce strain on the elbow during lifting and gripping. With consistent exercise and gradual progression, many people improve over 6 to 12 weeks. Exercises may not be appropriate for everyone. If symptoms worsen or persist, seek assessment from a qualified healthcare professional. Thank you for watching.